All right, all right. Hey guys, welcome back to my YouTube video channel. I'm Dr. Lachlan. Today I have a quick share of my presentation for new dentists and dental assistant regarding how to take intraoral photo and extraoral photo to keep the record for the patient, especially cosmetics dentistry and orthodontist work. So without further, I'm going to jump right into my presentation. Feel free to ask me a question after this presentation is done. So let's jump right in, guys. How to take intraoral photo and extraoral photo for this presentation mostly focused for dental assistant and a new dentist, and also for those of you who are interested in dentistry, what you can learn before you go to dentistry. I just want to, my goal is to, for this presentation is to help dental assistant to grow your professional's career so you be more valuable employee for your boss. Help any dental assistant who want to work in cosmetics dentist office and orthodontist office. Also help any dental assistant who want to make more money than what you currently make. So the goal is to improve your skill, the clinical skill. Also, I want to encourage high school students who want to learn about dentistry can learn this as well. The next thing, I just want to talk a little bit about dental assistant and why choosing dentistry. As you know, dentistry is a great opportunity for high school and college kids want to be in dentistry nowadays. Dentistry there's a big demand in workforce in dental assistant, dental hygienist, and dentist nowadays. But after the pandemic, dentistry is fun and rewarding and unique and dedicated career. It's actually less stressed compared to medicine. And so if you compare between dentistry and medicine, we would say we are lucky to have this field because a lot more less stress compared to whether you're a dentist or a dental assistant, a lot more less stress than a nurse or a doctor. You get to go home early compared to a nurse. You might stay work longer hour, and you have a chance to talk to patient and meet new people every day at your work. You gain dental and medical knowledge as you work with patients that have medical issue. You learn a lot. It help your family, and it help you build and raise your family in the intellectual way. Your hour working is flexible and professional, is very professional career, and it's an opportunity for you to grow, become a business leader, manager, researcher, international, national, local speaker or lecturer, and you can influence the community of dentistry as well as the population, the general population. And so today's topic, we're going to focus on how to take good take good photos. So I tried to put some armamentarium tool. You need sort of 5 to 6 item minimally investment. Okay, you need your phone. Everybody has the phone, a digital phone, iPhone or Android, Samsung, anything like that. That's wonderful. You need short light, so you can buy from Amazon these light short. You need to have lip retractor. You need to have the mirror with the fans to reduce fogging, and you need the stereo background if you want to take extraoral photo. And also, if you don't have assistant, you can have your patient help you. Now, before we go further, I want to announce that we have a Dr. Gala in June 8 to 10 in Italy, in the beautiful island of Sardinia. Island. I welcome and recommend everybody, whether you're a doctor, pharmacist, anyone that in the healthcare profession, we're more than welcome to share this online and join us in the big Dr. Gala symposium. Those of you who are in the top 100 doctor list last year and the year before and this year, you can certainly join and get receive a recognition of that red carpet event. It's a beautiful event. So without further, I want to jump right in. Just go ahead and show you some picture that my assistant take. As you can see, each shot, it have a different perspective and meaning. Another shot here. So what I'm trying to say to you is photography is actually an art, and it's really important for you to have enough light and have enough investment so you can get decent photo for your patient. So I just type in Google studio light, and you can see it pop out a lot. The price of any of these light source less than $100, very affordable. And if you continue to type in, you can see down here more light, and could go up to $200, $300, but you don't need to pay a lot of money. You can spend less than $100 and get a decent support. The other thing that I want you to introduce you is this device that it attached to your phone, your cell phone, and you can take a photo close shot. And it's you go to Photodontist.com, Photodontist.com. And you can see this, and you can buy this from Dr. Wu Li. And he's the inventor of this device. It's wonderful to have this device for that. It is designed for dentists. A lot of people using it. The other item is you should have it, the occlusal view mirror. And on Amazon, if you type in Antifogging Mirror for oral photography, you will see this one. It have a fence and it have a light. It's wonderful. It's less than $50, $51 here. Another device that you might need is the lip retractor. Another device you can. These are Amazon items. You can see it's very affordable. Maximum is $30, $35. And this is another item. I'm just giving you some example of what you like to try out. Okay, these are the black retractor, beautiful for cosmetics dentists. Another black retractor on Amazon, and another background. You don't have to buy this $1,000 equipment. All you need is just some other brand. It's just a couple of $50, the different color of the background, and you can use it. Now, so here's an example how I use the device from Photodontist.com. And attach my phone and take photo, and I didn't have to use like $3,000 equipment. This is just an iPhone. So you can see it's very the quality of the picture is wonderful. Now it's just for the dental assistant. When you take photo, make sure you have the consent form signed by a patient that allow you to use it for educational purpose or research. First shot right here. This is ExtraOral Photo, right side, left side, and middle side. Now the quality of these photos, top and bottom, you can see a big difference because of the lack of light on the bottom. The tip look yellow. Another photo of using the Photodontist device attached to the cell phone. You can see the quality is improved right away when there's enough light. When on the bottom here, there's not enough light, as you can see, it can look really dark. Now, as far as the the quality of photo that you are taking, make sure that when you put inside the page mount, you get all the occlusion view, and you get all the retraction of the lip, and this you consider a quality photo. And this is another example of good photo. Retraction everywhere. I'm going to show you. This is decent retraction. And this is not so good. I want to show you this is not so good. The lip cover part of it, and bottom too, not bad. I can see everything down here, but you want to have the lip to be pulled away so you can have more picture. As you just see like here, this is better quality photo. Here is a, I would say, acceptable photo. If you are a dental assistant and taking photo for your dentist, this is acceptable. This is not acceptable, and the occlusal view with a fog in here, I don't know what's going on. That's because of the basin brief, the moisture in. Make sure you have the slow suction inside the basin mouth. You'll be able to get a nice photo. Again, these are decent photo with full retractor. This is bad photo. I'm showing you right here. This is bad. You see, why would you take nose, eyes, lip, and everything? Not good. This is what you want to do and focus. Zoom it in. We have a digital. We can zoom it in. Another one here. This is a decent photo. Not even though you didn't get the back one, but you can get zoom in. This is bad photo when you get like you take so many area of patient like lip and face, skin, hair. Not good. This is poor imaging. Want to show you good and bad. Again, this is supposed to be a zoom in photo here, but see this then the assistant take a photo with like capture face of the patient. It's useless. We don't like this. You know, it's just a noise when I see patient, then the assistant or dentist take photo like this and share on to people. Here's another photo that is reasonable, but I don't like how the tongue there. You should have to have the patient to swallow it and push the tongue back, and before you take the photo, otherwise the tongue cover the occlusal view. if you want to review whether the patient have cavity or not. So this is not a good photo. Again, this is not good photo when you see the lip on top cover. You have to make sure the patient relax and pull away. Here is the picture, I would say acceptable. You can see the gum bleeding and all of that. So some of these are good, some of these are bad. Like this one is not good. Not good, not good. On the first, third, on the middle line here. Not good here, guys. Okay. That's enough. And then another one, I just want to show you that, you know, if you take a quality photo, you can present it to a patient that, oh yeah, you got an infection here, tartar buildup, and you need a deep cleaning. Very easy to sell the case. Here is another case where a patient come from out of office with no lack of oral hygiene and wearing braces for a number of years, gum overgrow, and bracket like this. So it's easy to talk about the problem of the patient when you have a quality photo. In conclusion, you guys, when you're taking photo, intra or extraoral, first of all, you need to have a consent from the patient if you are using it for professional for education purpose. You need to have light. If you don't have enough light, the quality is going to be bad. So a lot more light, get it from Amazon, and you need to retract all the soft tissue and make sure that when you take the occlusal view, you got to have a suction system, whether it's the antifogging mirror or slow suction placing. It's very important to do that. And evaluate your photo before you let the patient go home. If you have bad photo, you don't want a patient go home because your job were to record the data on that day. And if you miss it, you can't get better. So after you do evaluate, if you have to retake it right on that day. Also arrange your patient photo, each of the patient photo right after patient leave or on that day, or when you go home. Don't wait for many weeks later. It's hard to identify who's the patient. So these are a tip and trick that I just want to let you know and share with you guys. And I encourage dental assistant to learn how to take these photos. Help your dentist, help your orthodontist. Wonderful opportunity to gain the trust for your boss. Thank you for watching. I hope you enjoy my video today. Hope to see you next video. Have a great day.